Good morning, everybody. It's Dr. Mary again here at Family First Chiropractic. I'm also the medical chair of Impacted Inc. And I want to talk to you today about what a concussion actually is. I use this poster often in my office. It breaks down all of the pieces of what happens during a concussion, what you can expect, what the outcomes are, what your symptoms might look like, and what testing works and what doesn't. But let's talk about what a concussion actually is. A concussion is when the head is traveling at a speed and impacts something else, causing the head to stop its movement. However, inside the head, the brain will continue to move and make contact with the inside of the skull. That's a concussion. There's a couple of types of concussion. That is a basic concussion. So whatever impacts the skull, whatever brain region, is the area that will be affected. Whatever that region of the brain controls then will also be infected. So if the front of the head were to impact the inside of the skull, that area controls math and concentration and eye movements. It also controls appreciation of music and color. So there's different regions of the brain that do different things. Now, another type of concussion is when that brain is moving, just like we said a second ago, and that skull stops and the brain hits, but then bounces back or recoils. And so the brain now will impact another area of the skull, and it will even sometimes twist as it does that. This causes a shearing force or a tearing force and can be very significant. This is called a countercoup concussion. These types of injuries tend to present with a lot more symptoms. They take longer to heal, and they're a little bit more serious. So when we're evaluating a patient who may have had a head injury, we're looking for a history of, did you impact your head off of anything, especially if it were a car wreck? But we're also looking at, was there a whiplash type of an effect? Because the head doesn't always have to impact something for the brain to be impacting the inside of the skull. If the force is fast enough and hard enough, like a rear-end collision for a car wreck, and you do get that snapping effect, that can be all it takes. And even low-speed impacts cause those kinds of problems. So we always do a thorough and complete exam. We go through that history, but then we do testing because there are no tests currently that can determine a concussion, not an MRI, not a CT, not an X-ray, but there are physical exam findings that very clearly indicate this. Now, there are tests in the works, and we're keeping an eye on that. In fact, Impacted Inc. is partnered with and following closely some research that's being done at Penn State University by the pediatrician there. He's currently developing a test that we hope comes to market that allows us to look at saliva markers for an indication of brain injury. So this will be huge, and we're watching these things closely. And if you have questions, go to our website, go to Impacted Inc.'s website, contact us, forward us your questions. We'll be happy to speak to you. We'll be happy to come to your facility and do a class for you. I hope this helps. I hope this gives you a better understanding what a concussion actually is, and I hope you have a great day.